Well, I'm a native Washingtonian, and I went to school at George Washington University Medical School. That's my hometown. And I stayed there for my general surgery residency and actually practiced in DC for about 9 years. And I came here to Baltimore Washington Medical Center, and I joined the faculty there at the University of Maryland. So I was attracted because this hospital has the best of both worlds, where you can practice good university medicine, but in a community setting, and it's hard to find that. And it worked really well for me. I have 4 children, and they keep me busy, but I'm also, I'm a doer. I don't like to sit still, so I'm a project person. And so at my house, I live in an old house, and I always have a project going on, something I'm getting ready to fix or change, and that's what keeps me busy. Most breast cancer patients are women, and women like information and they like to make informed health decisions. They don't want someone saying, okay, dearie, this is what you do. And we believe that's our focus, and we provide a lot of information. We describe lab reports, pathology, options, and then we follow it up with preoperative teaching, and I think that the women find that very important. They want to know what's out there. They want to know what you offer. Many of them have been online, and they're very pleased to hear when you've offered them exactly the most cutting-edge thing that they've just read about. And the final thing is they want to be treated with respect and kindness, and we do that. Everybody on my staff is devoted to making our patients feel comfortable. So when we work with the ladies, they're frightened, and I understand where that's coming from. And we listen to their families, and we try and make it as easy on them as we can. I mean, breast disease and breast cancer is scary, and I think people should be nice to you. And it's the philosophy of our entire breast center. Breast surgery has changed dramatically over the last 20 years, from the time where they told you, okay, you have breast cancer and you need a mastectomy, and then good luck. And now there's tailored therapies, less invasive surgery. We still rarely need to do mastectomies, but we've got reconstructive options, which are just phenomenal. And then there's the amount of information we can find out before we ever go to the OR. The imaging has improved, so I'm rarely surprised when we get in there. I pretty much know what's going to be happening. And we have targeted therapies. We're learning a lot more about the biology of the tumor. They're like individuals, there's not vanilla breast cancer, and it helps us know exactly the best way and the best treatments for each woman. This is a great hospital. I've worked in a lot, and this is a great hospital for a lot of reasons. I think it comes from an administration that is genuinely interested in the community and makes wise choices as far as resources for what the community needs. But there's also a staff and nursing staff that's invested in the hospital. A lot of the nurses have worked here 20, 30 years. This is their neighborhood. Their families come here, and you can tell. They bring it on every day to work, and they care about the patients in their community. It's a nice place to be. What I hear over and over again was how pleasant an experience it was, how easy an experience was, how the facility was so nice, everybody was attentive, they felt their needs were met. And I think that there is a focus on listening to patients and not just having a prescribed course of therapy, and it comes at every level in this facility.